Welcome, everyone. My name is Mary Prentice. I use she, her pronouns, and I'm the Student Engagement and First Year Experience Coordinator here at Lewis and Clark College. I graduated from Lewis and Clark, and I'm currently in grad school here, so love the Lewis and Clark community and welcome you all. I have the privilege of working with Gabby, our Student Director of First Year Experience, different from Gabby Herman, who will also be joining us from the case management today. You should have been getting some texts from her. As an office, we're really excited for you to come join us here in the fall at Lewis and Clark College. This webinar is just one in a series that we have over the summer to get you guys ready to come onto campus. If you need to leave early or you didn't make it to any of our previous ones, don't worry. They are recorded and available on our website. Today's guests are here to help us talk about some of the support systems that we have in place here for you on campus. Health and Wellbeing for students on campus is one of our top priorities. So thank you for joining us today. To help lead this webinar, we have some different campus partners. We have Robin, who is the Director of Counseling and the Associate Vice President of Student Health and Wellbeing. We have Gabby Herman, our case manager on campus. We have McKinley, who is one of the registered nurses who works at the Student Health Center. And then we have Chelsea, who is just joining us today to talk about some other important health information, and we'll introduce her position as well. Thank you all for joining us.
Perfect. Okay. And you can go ahead to the next slide, Mary. Thank you all. Strange. It's still got some weird stuff in there. Okay. We do have a student counseling center on campus, and we provide confidential personal mental health psychotherapy. We are staffed by licensed providers. So we have psychologists, licensed clinical social workers, and licensed professional counselors. We also are a training site. So from 3 different graduate programs in the Portland area, we invite and train advanced graduate trainees from psychologists in training and licensed professional counselors in training from our own graduate school here at Lewis and Clark, and then from George Fox College or George Fox University and Pacific University. We evaluate students when they come in and really try to get a sense of what are their individual needs. Then we make care recommendations following an initial 30-minute consultation. That helps us to really know whether their most useful resource is the counseling center for some ongoing individual or group or relationship counseling or psychotherapy, or if we would recommend a referral to a specialist off campus, or sometimes there are a lot of other resources on campus that are available that we can help just direct them to the best resource to meet their needs. If they are seen, or anytime someone is seen in the Student Counseling Center, we have the same level of confidentiality and privilege under the law that any licensed mental health provider in the state would have. And so that means even though we are part of the college and conveniently located on campus, that none of the information about a student's access to any of the services at the Student Counseling Center would be shared outside of the counseling center unless we have the written approval of that student or request of that student and written approval to authorize sharing that information. For some people, there's a benefit in sharing for a variety of reasons, and so we do have a release that they can sign. And also our services are available for just consultation. So a student worried or concerned about another student or a family member, family, friends, faculty, staff who are concerned about a student's emotional well-being or mental health can call and talk to us or meet with us, and we can help problem solve. Again, if the student of concern has had any contact with the counseling center, we wouldn't share any of that information or that they'd even been here, but we can consult about what are some ways to help someone when they are struggling with their emotional or mental health. What are some resources and strategies for helping them consider accessing those resources? And so we are a service also to folks who just need some support around how do I help a friend or a family member. And we also do educational outreach, which is not on the slide, but I would share with that we do preventive and psychoeducational outreach across campus and training. And we are happy to serve our campus. You can go ahead to the next slide. Thanks, Mary. We also want to make sure that everybody knows we do provide crisis and urgent support. Right here at the Student Counseling Center, we offer same or next day urgent appointments on weekdays. Every weekday between 1 and 3 p.m., students can just drop by and see a counselor. And if for any reason we've had several people drop by at the same time and we aren't able to accommodate everybody, we do a little bit of determining the urgency and might schedule them the next day, but they're definitely going to be seen that day or the next day at the latest. And so we do encourage students to just drop in if they're not sure if they need an appointment or they just need to come in one time. They're welcome to do that. We also have a program on our campus called the Welfare Intervention Network. I'm just going to give a little shout out to WIN right now, as our abbreviation is WIN. That is a network of professionals on campus who meet routinely to help students to have support on campus and to reach out to students who we hear about who may be having some concerns. I'm going to let Gabby talk about that a little bit later when she talks about case management. But other students, faculty, staff, or concerned family are all able to let us know if there's a student they're concerned about. And then we have a strategy for understanding maybe how's the best way to reach out to that student and let them know about our resources and get them some options. We also have after hours help. Our campus safety officers are here 24/7, 365. They're wonderful and amazing, and they can respond if we're concerned about a student overnight or on the weekends or holidays. We also encourage students to use crisis support. They can use the 988 line to find our local crisis number or crisis services. Can use the crisis text line. And you can also go to the counseling center, and several other of our offices are all linked to a page that shares a lot of more specialized crisis and urgent support options for our students. Go ahead, Mary. Thank you. So we do have really excellent resources on campus for students who have some need for one-time or ongoing support. We also want to acknowledge that this is a high demand service and that there can be times when the needs of a student may exceed the scope of what we're able to provide, or there could be a delay in scheduling them ongoing with a dedicated counselor to provide ongoing care. So we do let folks know really on a lot of the time, a lot of our students are seen every other week, sometimes even less frequency, less frequently, but that, and we, again, individually assess, we talk with the students about that, but we know that if someone knows, oh man, I have been doing weekly long-term therapy for the last 4 years, and I really benefit from that, or they know, I really want a specialized treatment. I want to go and work with someone who is certified in providing EMDR, for instance, or I need really very wraparound support to maintain my progress on managing an eating disorder, things like that. Or if they're wanting testing for instance, autism or ADHD or a learning disability, or a specialized psychiatric provider. These are things that we have very limited access to on campus or no access to on campus. I'll explain that in a moment. And so we encourage people to start now. Contact your insurance company. Learn about current providers in the Portland area or in Oregon if you're open to telehealth, and start contacting providers now. Sometimes it takes a little bit of time to get in if there are waits. Um, if you will have the college-sponsored insurance, Chelsea will talk about that a little bit later, but you can start to find providers. You may not be able to schedule an appointment yet, but you can start to identify providers and see who looks like a good fit. If you're wanting help with finding providers, you can definitely meet with Gabby, who will be speaking in a moment, in case management, or reach out to her in August to get some ideas. Or you can reach out to the counseling center, and we are happy to provide ideas or suggestions for folks that you might reach out to in the Portland area, or to let you know, oh yeah, that's something we can cover just fine on campus. We do not have a psychiatrist or a psychiatric mental health nurse practitioner on campus, but our student health center on campus does provide some level of support for psychotropic medications or medications to manage mental health concerns. And so you may be able to be seen on campus. Or, for instance, some specialized therapies we can provide on campus, but others we can't. So if you're not sure, schedule an initial consultation with us and we can talk it through with you, and give you some individualized guidance, or email us over the summer and we're happy to give some suggestions. And that is the quick overview of Student Counseling Center. So I'm going to go on to the next section, which is going to be, I oversee the Office of Health Promotion and Wellness, and our director, Jenna Reinhardt, is not available for this webinar. So I'm going to cover her information as well. Go ahead, Mary. Thank you. Okay, we have an awesome office on campus, Health Promotion and Wellness. This is an office that is out and about and on campus all the time, providing resources, education, and prevention programs on topics that are really important to our students. The primary topics that they address are issues of interpersonal violence prevention, advocacy for anyone who experiences unwanted sexual contact, or has concerns around maybe gender-based violence or gender-based discrimination. They talk about sexual health, substance use, body image, nutrition, sleep hygiene, social health, all kinds of topics. And our health promotion wellness team are here to promote healthy decision making, teach health literacy, help you with skill development, and provide support if you are facing health-related challenges. It is very important to note that the Health Promotion and Wellness Office are not licensed medical healthcare providers or trained healthcare providers. They are public health providers. So they do not diagnose or treat health or mental health concerns. For anyone who is seeking treatment or evaluation for a health or mental health concern, it would be student counseling or the Student Health Center. Health Promotion and Wellness can give you lots of great resources, education, and prevention programs, and that is their role on campus. You can go ahead to the next slide. And so we just want to let you know that one of the things that you're going to be hearing about is you do need to do some online education modules this summer. They'll be coming along in early August, and those are required by the state or federal governments. and on several topics. And we want you to watch out for that communication because it is really important and required for you to complete those modules. Um, um, they also do programming, as I mentioned. I mentioned the Confidential Advocates program, and another program that they do for people who are wondering about support or just kind of curious about their own use of substances. They have a program that's really lovely and non-judgmental called RISE. And they just help you to reflect on your use. They inform you about just really straightforward information about various substances and provide support and empowerment if you decide to talk with them. And sometimes when people run into a little bit of a conduct issue on campus, sometimes they're referred for that optional. They're optionally referred as one of their options for conduct to learn more about their use. Thank you. Mary, you can go ahead. And then I'm going to turn it over to McKinley to share information about the Student Health Center. Thank you.
Hello, I'm McKinley. I'm a nurse and I work in the Student Health Center. You can go ahead and head on to the first slide. So we are located on campus and we are open Monday, Tuesday, Thursday, and Friday from 8 to 4:30. We are closed Wednesdays and then closed on the weekends. We are staffed with myself, a nurse, two nurse practitioners, and a doctor, and then also a front desk receptionist. You can make an appointment just kind of like your primary care provider and have an assessment, see a provider. They can order labs, they can refer you to off-campus providers. And just to talk with the provider, there's a $5 fee that will go on your student account. And then depending on what they decide to order for you, if you get like a strep test or labs drawn, there will be additional fees for that. We can do blood work and we just send it off campus to Quest and they're able to bill your insurance directly for that. Um, there's no, your insurance isn't billed for the office visit, it's just the $5 fee. And then here's kind of an overview of our services. Um, we have some prescriptions on campus, several antibiotics. We have some immunizations, and then we can refer you for things off campus like x-rays or physical therapy. All right, next slide. And then you do need to do a few things over the summer. So you're required to have 2 doses of MMR on file. So if you're able to do it as soon as you can, you'll create an account on the health information portal, and then you'll enter your dates that you received the 2 MMR doses. And you want to make sure you do this before you come to campus. Otherwise, you'll have to come talk to us before you can receive your room keys. And when you're logging in and doing that, you can also import your health history and upload your insurance information. All right, next slide. And this is what the health information portal looks like. You'll see the tabs over on the left. And go ahead and click to the next slide. So that you'll click the immunizations tab and then you can enter your MMR dates and that'll send that to our office for review. And next slide. And then you can hit forms on the left and fill out your health history form. And one more thing while you're there, you could hit insurance and then upload a copy of your insurance information so that we have that on file in case you need any labs or referrals. And then if you need medical help when we're closed, so after 4:30 on a weekday, Wednesdays, or the weekends, we have a nurse advice line that you can call, and that's available on the Student Health Center webpage. And then usually with your personal insurance, there'll be a nurse advice line that you can call as well. So you can check that out. And then we have a list of all of the closest urgent cares and ERs. And then there's also a house call service called Dispatch Health that we have some information on our website as well.
I'm just gonna pop in briefly on the immunization. There is also an option if you prefer to request that states that have digital registries of vaccinations can automatically upload your dates. So you'll find all that information. You're going to get a welcome letter that if you haven't already gotten it, that will let you know a lot more detail about the immunization requirement. And the other thing I want to say briefly is if you have the student health insurance, then you will be able to be reimbursed 100% for any of the services charged at the health center. But also anyone else who wants to submit a claim to their insurance, they certainly can download from that portal a statement and submit that to your insurance to see what might be covered.
Okay, everybody. My name is Gabby Herman. I use she, her pronouns. I'm the case manager here at Lewis and Clark. Mary, if you could go forward one. Okay, so what is case management? I feel like that's kind of a weird term, and sometimes people are like, I don't know what you're talking about. Really, at the heart of it, it's about helping students connect to resources, whether that be on or off campus, helping them navigate those resources. So learning how to make phone calls, learning how to talk to insurance, what questions to ask, how to be an adult in a lot of ways. Um, Helping folks really engage in those, assess like, is this what's best for you? Is this working for you? And then helping students identify and set some more tangible goals and kind of helping them remove those obstacles to being here, being their best student self, being as healthy and well as possible. So it is not confidential like here on campus, so I can't, and I tell students this too, when we meet, I can talk to their college advisor if they want me to. I can share information with the counseling center. It's like, here's some info. I can talk to their area director, to a variety of support folks who are staff members on campus if that is in their best educational interest. I cannot talk to parents and guardians or anyone off campus about a student unless you've signed a release and filed that with the registrar's office. So FERPA does still apply, but it's not like counseling or the health center, and that's an important distinction. I'm not a therapist, I'm not a counselor. I can connect you with them, but that's not a service I provide. My office is physically located inside of the Office of Student Accessibility, but I do not do accommodations. I don't do disability services. I just am here. Not a tutor. And then also, I don't do things for you. We do them together as a team. I like to tell students, we're a team now, like, let's get it done. What is it that you need? Let's figure it out together. So some common reasons, like Robin was mentioning earlier, if you come into school and knowing that you want someone every Tuesday, 10 a.m. for the rest of your time here, kind of therapy, let me know. We can work together on that, find someone that feels good to you. Same with psychiatry. I can help folks do that as well. I also see a lot of folks who are wondering how to get an assessment for like learning disabilities, ADHD, autism, things like that. Understanding and navigating insurance for the first time as an adult, kind of that problem solving goal setting I talked about a minute ago. And then just what is it like to be a student here? What do you need? How can you find it? How can you get it? I also am on the Welfare Intervention Network, which Robin referred to earlier as well. So that is a group of staff members from a variety of areas on campus, disability services, academic advising, campus living, athletics, campus safety, a whole host of folks. And we come together and kind of discuss students of concern, students who might be at risk to themselves or others, and we talk about how to support them. So a lot of outreach comes from me, and we can receive reports from anybody in the community. We get them sometimes from parents, students who are worried about a friend, professors, other staff members. things like that. And that link was one of your slides, Robin, as well. But yeah, I always tell students if you need something, you don't really know what it is, you don't really know where to go, this is a good one-stop shop. Let's figure it out together. And I'll have to pop off at 3, so I'll be able to answer questions if we go past that. But that's my email. So please email me. Let me know if you need anything. I'm a 10-month employee, so I won't be here in July. But you can catch me now or in August. I'm happy to work with you before you get here.
Hey everyone, it's Chelsea. I use she, her pronouns. I am the administrative support for the student health insurance program here on campus. And I also happen to be administrative support for the Student Counseling Center as well. So if we could go to the next slide, and I'll just do a real brief overview here. So Lewis and Clark requires that students have comprehensive health insurance. Um, so that so all undergrad students, you're going to be automatically enrolled in the school's sponsored health insurance plan, which is through Pacific Source, at the beginning of each academic year. If you don't want to be enrolled, and if you have coverage that meets the same criteria as ours, that criteria is listed on our website, then you can apply to waive the school's coverage. The way you would do that, you'll receive this information in your welcome letter, and then also if you go to lclark.edu, search health insurance will be the first thing that comes up. There will be information there about declining coverage. So if you meet the requirements, if your coverage that you currently have is comparable to this Lewis and Clark's coverage through Pacific Source, then you can go online and submit a waiver. To do that, there's a link, you can find it, and you'll need to submit that. You can do it starting now. The deadline to have that submitted and to not be covered by the student health insurance is September 14th. That's a hard deadline, so please make sure to have that waiver in as soon as possible. If you get it in before June 29th, then it shouldn't show up on your first statement from student accounts. Let me clarify. If your waiver has been submitted and approved by June 29th, then it shouldn't show up on your statement. I specify and approved because once you submit the waiver, it's going to be reviewed. And there are a number of reasons why that waiver might be declined. Anything between the insurance that you have not being comparable, down to very simple things like needing to, just if you happen to upload a card, which you don't need to do, but if you do upload a member card and it doesn't have your name on it, if you're getting it through a parent and only has the parent's name on it, then they'll ask you to upload that again. So just start the waiver process as soon as possible to be able to get through that by either June 29th, to not have it on that first statement, and then make sure it's approved before September 14th. And that is what I have to present. Questions are welcome.
Perfect. Thank you so much, everyone. We're going to start the Q&A now. So if you have any questions, you're able to type them in the Q&A. As we wait for some incoming questions, do any of you have any commonly asked questions from your office and any suggestions for new students?
I don't think I mentioned in my slides regarding the Student Counseling Center that mental health counseling on campus, or really any of our consultations or groups and everything, are at no additional cost to the students. And so pretty good deal seeing licensed folks or folks in training supervised by licensed providers on campus is both easy to access and at no additional cost to you. Other than if you show a scheduled appointment, then there is a fee. But that's something that does that's a question that comes up sometimes.
It seems that we have two questions. One of the students is asking, can you waive immunizations due to religious or medical or personal reasons?
Yeah, you will be able to see when you've received the information with the new student welcome letter, it will direct you to our to a site that if you'll see a lot of information with the new student welcome letter for your college for undergrads. If you scroll before going into that, scroll all the way down to the bottom of the page. If you feel that you would meet exemption criteria for a medical exemption or a non-medical exemption, and that can include anything from I have a religious belief that precludes having this immunization, or a personal decision not to take the immunizations. You will need education about that choice, and the state of Oregon does require that you either have a meeting with a medical professional who will document that they gave you information, or have a really lovely online tutorial that is linked on that site. And that information, that course that you go through, it's not very long, and then it produces a certificate. So there's a form for a medical exemption that has to be completed by a medical doctor or a nurse practitioner. Or there's the non-medical, where you either need to have a signed form from a doctor, or you can do the certificate from the state. And all of that information is available on that site. And you're going to be getting so many reminders about how to find that. But if you want to go and find that now, you'll just need to send us at the health center that documentation signed and dated, and then you will be given that exemption if it meets all the criteria.
Awesome, thank you. There's another question from a student that is, can students who are currently on medications for ADHD get their prescriptions on campus, or is there a preferred pharmacy we should use?
I can answer that one. So we do have a very small pharmacy on campus, but we don't fill any prescriptions. So we just have a couple antibiotics and a few other things that our providers here can prescribe. So if you already have a prescription for ADHD medication, you'll just want to send it to a nearby pharmacy. A lot of students like to use the Fred Meyer on Barber because it's close by and the shuttle can take you directly there.
I'm going to add to that. Our providers also don't prescribe for ADHD. And so if you are wanting to from out of state and if you're going to need a provider in state, then Gabby or the health center can help with referrals to have that picked up by a prescribing provider here in Oregon. But sometimes you can just transfer your prescription if you have an ongoing one and you have a provider that will be happy to maintain that to the pharmacy, as McKinley mentioned.
Thank you. There's another question of a student. Is the Student Health Center office visit at $5 for anyone regardless of insurance provider?
Yes, that is regardless of insurance provider, with the exception of if a student has our Oregon health plan, which is a Medicare Medicare plan, then Medicaid. I always mix those two, whichever it is.
Medicaid.
Thank you, Medicaid plan for Oregon. That the agreement in our state is that we would not charge for our services, so that would be waived in that case. But otherwise, no insurance is required to be seen at the health center. It's required to have it, but we don't bill it at all.
Could I jump in real quick? I typed out an answer to one of the questions, but I just wanted to address it out loud as well. So one of you asked, they said, I have two concerns. First, I tried two links sent from the student health email to fill out the waiver, and they both say access denied. So for that, I did type in a couple of links. We are having an issue with the link that's sent by to everyone, so we are working on that. But either this first link here will work, or you can go to this other website, the second link, and then click on waive coverage. Both of those ways should pull up the waiver. And if those don't work using whichever browser you're using at the moment, try those links using a different browser. If you still have problems, you can email Stu Health Insurance at lclark.edu, and we can help you troubleshoot that. The second one is might apply to some of you also. It says my insurance is requiring a proof of registration with the classes that I'm taking. How can I give them that before the deadline for the waiver? That is not something I've come across before, and so it would be great if you could email Stu Health Insurance at lclark.edu, and we can help work through that and see what we need to work through that. Yep. Thanks.
Right, we have two more questions. One says, how can I change information from the health history form if something changes in the next few months?
When you come in for an appointment at the health center, you'll check in and you can update any of your changed medications, and then just let your provider know if anything in your health history has changed, and we can update your chart.
Last one. Can students create their health account and provide their immunization information now, or do we need to wait until later in the summer?
I believe it is available now. Robin, is that right?
Okay, so this is a tricky one. If you have received a message from lclark.edu that is a welcome and it invites you to, it gives a lot of information, but it's mostly about the providing your immunization information. when you have that, that means you're actively in our system. However, you also have to have had your Lewis and Clark email address active for at least 24 hours. So if both of those things have happened, then you should have no trouble registering for the health information portal. And I think most of you are probably able to do it right now, but if you're having any difficulty, please email us at health@lclark.edu, and we will help troubleshoot specifically for you if you're not able to get in. But everybody should be ready to go ahead and enter that information now.
Perfect. Those are all of the Q&A questions that we have. Thank you all so much for joining us.
Sorry, Mary. It seems that we have one more question. Another student is asking if you have a schedule controlled substance prescription, are you allowed to keep it in your dorms?
Let me see if I'm going to read that. Okay. My understanding is if you have any medication that is prescribed to you and you are legally prescribed that medication, yes, you can keep your medication in your room. If your medication requires refrigeration or something like that, you're going to need to make arrangements to have, a fridge and stuff. But I do also want to encourage, if you do have, especially a controlled prescription that might be one that others might take off of their prescription. In other words, are used recreationally, or people are trying them out, but they don't have the prescription, so they might be tempting to try. I would recommend, like a stimulant medication is what I'm getting at. Then I would recommend that you consider bringing a small lockbox and having your medication only have a pill minder and have out the amount that you need for the week, but have your prescription bottle locked and put away. And that way it's just going to stay contained and available for your use. And not that we have a big issue of theft, but just that it is it's just a wise thing to keep it managed.
Perfect. And just a reminder, if you have any other very specific questions, you can always reach out to any of us here. Like Robin said, health at lclark.edu. And we are all happy to answer those questions and help figure out maybe specific health needs. Thank you so much all for joining. Again, we have a webinar this Thursday that is all about finances and settling accounts, and I hope to see you there. Thank you, everyone.